Okay, welcome to class, everyone. This is our first recorded lecture presented in Prezi and via voiceover at least. I'm glad to see you today. I know we've had orientation already, but I do want to make sure that you are aware of the lectures that are present and also are able to access the audio portions of each of these lectures in Top Hat and can see the benefit of the clicker questions, and hopefully we'll have great interaction during this entire semester. So I'll piece out each of the lectures into shorter chunks. Hopefully that'll help you out as far as when you can listen to things and getting to your place and how that works. Also, I want you to know that my lectures and slides have content on them. However, the content is not complete. You need to be an active note taker and active reader in class in order to obtain all the information that's required for doing well on your exams. The components of being a good geriatric nurse really depend on your ability to be a thoughtful investigative reporter or detective. You need to put together a lot of pieces and try to see the person as a holistic individual instead of just the disease that they're there to see you about right at any given moment. So use those detective skills. Read everything you can get your hands on. Seek out different alternatives and try to figure out what's going on with each of your patients and residents who are older than your typical age. All right, so we know already that everyone's aging right here and right now. From the time you're born until the time you die, you're continually and constantly aging. That process involves cellular steps, so we'll talk about some pathophysiological processes. We'll also talk about some social and societal processes and things like stigma and ageism, cultural impacts of aging. We're going to really look at aging as a huge whole comprehensive component, and also discuss why aging is at the forefront of nursing discussions as we see them today. So to start out, so what really is old? How old is old? If you talk to the federal government, they're going to say 65. And once you turn 65, you're old. If you talk to your grandparents, they're probably going to say that they aren't old, regardless of how old they actually are in years. So you want to think about that number as being fairly arbitrary. Age discrimination also occurs in workplaces, for auto insurance policies, and in healthcare, so we need to be aware of that as well. And the categories that the federal government has set aside are listed on your slide as far as what's young old, middle old, and old old. We now also have centurions that are more prevalent than ever in the country and actually around the world. There's a few places where we have so many centurions that they call them the blue zones, where people really thrive and do well into their hundreds. So consider that that number again isn't necessarily a good descriptor of where your health status is or how that person feels. And the term old can be very stigmatizing. So when you think of elderly, old people, or seniors, you might get some mental images in your head. You might see images like this where individuals are needing assistance with feeding or walking, some media resources that demonstrate ageism or other biased methods. You might see something or think of something a little bit more active where individuals are engaged in their community resources, where they're physically fit and working towards some active goals. Typically, you don't think of older adults as running marathons, races, or anything else, and certainly you don't think of older adults in these terms. These three people are well over their 80s. They are extremely active and physically fit. And of course, you're going to see a wide variety of extremes in healthcare, not only with this age group, but you do with a lot of different age groups as well. So just try not to be too stereotypical when you work with older adults. It's important to understand why we're so concerned about older adults at this point in history. And if you think about the past couple of decades, in 2008 we had 40 million people over the age of 65. That was about 13% of the population. In 2011, the first baby boomers, that generation turned 65, and by 2030 we're going to have over 72 million people over the age of 65, which is nearly 20% of the population. So basically right now, older adults outnumber younger adults, and from this point forward they always will, based on how population trends have occurred since World War II, basically. Also in life expectancy, we're seeing that life expectancy has increased from 47.3 years to 78.7 years and 81.0 years for women. So this is almost a double in life expectancy. A couple things have caused this. Number one, we've seen that many health preventative measures have been taken place. We've also changed the trajectory of illness from primarily infectious diseases to now more chronic illnesses and conditions. We also have been able to see that we've decreased the mortality rate, fetal mortality rate, and we've also greatly expanded that life expectancy range. A lot of things have helped with that. I mean, we invented penicillin and saw that that could treat a lot of infections. Now, today, we are actually seeing some downsides of widespread antibiotic use, but vaccinations that have eradicated early childhood diseases that killed hundreds and thousands of kids, even the chickenpox. And so we've been able to see a lot of different things that have all come together to help improve that life expectancy. When we look at life expectancy across different ethnic and racial groups, we also see that the life expectancy is about 78, almost 79 years for white or Caucasian persons, and about 75 years for persons of darker skin tones. Some of that has to do with some of the conditions that seem to impact persons with darker skin tones more frequently than others. And again, that's just all based on the numbers that are presented across the country and the world. We do see that women live about 5 to 6 years longer than men, and that goes across all races, regardless of your skin tone. But those boomers, 77 million baby boomers, they're coming. And while we just started to see some of them entering the healthcare arena, we still got quite a few years of baby boomers to come and join that group. One thing I thought was interesting, I read a short little flyer on baby boomers and their health care, and it was noted that in a survey, 73% suffered from at least one chronic condition. That would be like arthritis, diabetes. 43% said it would take a life-threatening illness to change their view of wellness, like a heart attack. And 46% do not exercise regularly, and about 1/3 feel dissatisfied with their primary healthcare providers, even if they have a primary healthcare provider. So you might be asking yourself, so what? Well, the so what really comes to no matter where you work, no matter where you go, you as a nurse will take care of older adults. Even if you work in the neonatal intensive care, there's grandparents that are going to be coming in, and at some point one of those is going to pass out, have a hypertensive crisis or some other type of problem that you will have to address. You'll always be addressing in those areas: education, instruction, mental health assistance, anxiety, if nothing else. But everyone will help take care of older adults, regardless of where you actually work. And so you want to make sure that you have the skills that will help prepare you to care for older adults in any setting. Gerontological nurses will play a very significant role in research, innovations, provision of services to this growing population. And you need very specialized knowledge. Like I mentioned in the beginning of this lecture, you need to be great detectives, great investigative reporters, and you have to find ways to help initiate and contribute to initiatives that impact the health and quality of life of our older population. Continued recruitment and education of nurses to meet this growing population is essential, especially as we're facing one of the largest nursing shortages that has ever occurred in this nation. So when do older adults get hospitalized? Well, whether they are younger or a little bit older, congestive heart failure is the number one reason why older adults get hospitalized. It's really hard to self-manage. People have frequent exacerbations, and we have some remissions that come in there too, but those exacerbations is what sends them to the hospital. So congestive heart failure, I want you to think about congestive heart failure in a more broad way. Certainly you could pick out congestive heart failure as an item on an exam, but remember that that's cardiac disease. And so cardiac disease is what gets them hospitalized. Number 2 for both ages, both of those are respiratory disorders. So COPD for the younger group and pneumonia for the older group. We'll talk more later in the semester about why pneumonia is higher than COPD in the older group. Basically comes down to the pathophysiological changes that occur as someone gets older. I wouldn't worry about memorizing these, putting them in order, or anything like that, but I would expect you to know number 1 reason people get hospitalized is congestive heart failure or cardiovascular diseases. And then the most common procedures that are done amongst older adults, blood transfusions, cardiac catheterizations, and upper GI endoscopies. So we're looking at some serious procedures, some that have life-saving implications, and along with that will go some medications that are pretty potent to help manage these conditions. So we will move on to the next section here in just a few minutes. There are 1 or 2 clicker questions for you to address next.